Imagine if I told you there's a plan to make America healthy again. And no, it's not just another political promise. This plan, it's based on real data and real solutions that everyone from both sides of the aisle can actually get behind. And today, I'm taking you on a deep dive into what it'll take to turn this vision into reality. What's up, everyone? Dr. Dynamo here. Now, we've all seen the headlines about America's health crisis: obesity, diabetes, skyrocketing healthcare costs. And the question on everyone's mind is, what do we actually do about it? Today, we're going beyond pointing fingers or playing the blame game. I'll show you real science-backed solutions that have been proven to work. And you know what? The research shows that America's health crisis isn't just an individual issue, it's a systems issue. And that's actually great news, because it means we can solve it by fixing those systems. And I'm going to walk you through exactly how we can do it. All right, let's break down where we are. According to the CDC, about 74% of Americans are overweight or obese, and about 40% of us are dealing with prediabetes or diabetes. And get this, a New England Journal of Medicine study projects that today's kids could be the first generation to live shorter lives than their parents. So what's the price tag on all this? It's a jaw-dropping $2.7 trillion annually. Now that's not just monopoly money, folks. That's the actual price of chronic disease on our economy every single year. And here's the kicker. It's not just because people are making poor choices. A major Lancet study tells us it's because the way our food and cities are set up is literally setting us up to fail. So yeah, this isn't just about skipping desserts or getting on a treadmill. It's about redesigning a broken system. Now, let's talk about food, the backbone of our health, and sometimes our downfall. Right now, our food system is, well, pretty upside down. A 2023 USDA report estimated that our food system's flaws cost us around $1.1 trillion a year. So how do we flip it right side up? First, agricultural subsidy reform. Right now, our taxes are actually supporting corn and soy production that fuels processed foods. Imagine what would happen if even a small percentage of those subsidies went toward fruits and vegetables. One Harvard study says it could save $47 billion in healthcare costs every year. That's a whole lot of healthy food and money coming back into our communities. Next, we have food desert investment. Picture neighborhoods with no real grocery stores, places where fresh fruits and veggies are practically luxuries. Research from the Urban Institute found that for every $1 million we invest in food deserts, healthcare costs drop by about $4.2 million, while local job creation and tax revenues skyrocket. Then there's school garden programs, a way to teach kids that food doesn't have to come from a box. A study in the Journal of School Health found that these gardens can reduce school meal costs and improve kids' health, providing a $2.78 return on every dollar invested. But last but not least, cooking education programs. Because what good are healthy foods if people don't know how to cook them? According to the Journal of Nutrition Education and Behavior, cooking programs provide about $3.67 return for every dollar spent. Families learn to cook on a budget and spend less on eating out, saving about $2,200 a year. This is the stuff that could actually change lives. Now, let's talk about the spaces we live in. When cities prioritize cars over people, it's not just bad for the planet, it's bad for our health. But here's where it gets good. Building infrastructure that promotes movement pays off big. Take protected bike lanes. Studies show that cities with bike lanes see an $8.23 return on every dollar invested, and up to a 44% reduction in healthcare costs from traffic-related injuries. And get this, families save about $7,400 a year when they switch to bike commuting or walking paths, not just sidewalks, but connected paths that make walking a real option for people. Research shows that for every dollar invested, we see a $4.72 return. These paths don't just get people moving. They reduce healthcare costs, increase local business revenue, and even boost property values. And then there's the magic of outdoor fitness parks. Picture your local playground for adults, a place where people can work out for free anytime. Research found that public fitness parks provide a $3.12 return on investment, with communities seeing reduced ER visits and lower healthcare costs. This is where fitness meets finance, and everyone wins. Now, we can't talk about health without talking about health care. Preventive care alone could save us $260 billion a year. Yes, billion with a B. Preventive care coverage makes a huge difference. Studies in health affairs show that it could reduce chronic diseases by 37% and lower ER visits by 42%. And for every dollar spent, it saves over $4 in healthcare costs. And what about medical education reform? I've talked about this in previous videos. Right now, doctors get minimal training in nutrition and lifestyle, but a New England Journal of Medicine study found that a little extra training goes a long way, improving patient outcomes by 31% and saving almost $2,000 per patient annually. Then there's health coaching. Think of it like personal trainers, but for managing chronic disease. A review in the Annals of Internal Medicine found that health coaching can improve chronic disease management by 52% and reduce hospital readmissions, saving about $3,600 per patient. Health isn't just a quick fix, it's a lifestyle. Okay, so how do we make this all happen? Research from the American Journal of Public Health says that the best approach is to work on 3 levels: local, state, and federal. Locally, community gardens, neighborhood wellness programs, and school health initiatives all build health right where people live and learn. At the state level, insurance reforms and public health policies can tackle big issues like chronic disease prevention. And federally, we're talking agricultural policy changes, healthcare reform, and funding for public health research. We're looking at an estimated $94 billion investment here, but the returns? A whopping $427 billion every year in savings. That's a 454% return for my statistics guys out there. The way I see it, we're sitting on a gold mine of health. So here's the big takeaway. America's health crisis isn't just a hopeless mess. With smart, science-backed changes, we can actually fix it. But change doesn't happen by itself. Drop a comment below about what's happening in your community to push for those solutions. What are you doing to make America healthier? Let's make this movement real, starting with each one of us. And remember, until next time, stay dynamic. Peace.